Oakdale Ear, Nose, and Throat Clinic provides services for the entire family. So we treat children, we treat adults, we treat senior citizens. We treat a variety of conditions in the head and neck, including conditions of the ear, the nose, and the throat. We have specialty expertise in areas of allergy, audiology, and sinuses. A lot more patients come into my practice that end up having a sinus-related complaint than they realize. Besides the traditional symptoms of facial pain, nasal congestion, postnasal drip, you see a lot of patients who come in with irritation in their throat or ear pain that end up really having a primary pathology within the sinus or nasal regions.
So sinuses are air-filled spaces in the head. There's a pair over the teeth, some between the eyes, over the forehead, and behind the eyes. And they're normally supposed to be full of air. We're not sure exactly what the purpose of them are. There are a lot of theories out there as to what they may be, but there's no real consensus as to what the importance of them are. But when they become chronically inflamed due to irritants, allergens, polyps, they'll begin to fill up with inflammatory tissue, fluid. They'll give you a sense of congestion, drainage, facial pressure, pain, headaches, and an inability to breathe well through the nose, as well as changes in your sense of smell or even taste.
Many patients who have been having chronic sinus disease have been having issues for years. We also will quite frequently look inside of the nasal passageway with a little camera called an endoscope. And oftentimes it leads to a diagnostic radiograph or a CT image being performed. We have both medical and procedural therapies. We will usually start with medications to try to help open up and relieve symptoms of sinusitis, although for cases where the medicines are ineffective, we have several procedural options available for patients. We have a variety of things that we're able to do to help people with both recurrent, acute, and chronic sinus issues. One of the things we've really been able to implement within our practice is office-based sinus dilation or balloon sinuplasty.
We by far are the leading group in the Twin Cities for doing nasal and sinus procedures in the office. That procedure, doing it in the office, really cuts down on the patient's pain afterwards, as well as their recovery time is dramatically reduced, and you don't have to undergo a general anesthetic then. So really no one else in the Twin Cities is doing that.
If you've been having symptoms that seem to not be responding to over-the-counter treatments or treatments provided by your primary care doctor, come see a qualified ear, nose, and throat specialist. We have ways of trying to investigate your symptoms and find out if there's something more serious going on, or if there's other therapeutic options that we have to help you.